everyone. I'm Annie. I'm the marketing director here at Recharge Clinic, and I'm sitting down with Melissa. She's one of our female nurse practitioners, and today we're going to be talking about hormones. So, Melissa, tell me, what kind of hormones do we treat at Recharge Clinic?
Great question. Well, we treat all hormones, really, men and women. We treat testosterone, estradiol. We focus on thyroid hormones here. All the hormones.
Okay, perfect. And what's a good age that people should kind of start considering hormone therapy, or when should they start?
Okay. Well, that's kind of a broad question. It would be different for everybody. It's when they need it. Are they suffering from symptoms of low estrogen, low testosterone? Are they having a thyroid that's not operating well, functioning at the highest level? That's not a specific age. It's going to really depend on the patient. So we just kind of talk with the patients. We ask them, we take their blood work and take a look at them and see specifically. So really, if you don't feel well, if you're not living your best life, that is the time to really kind of say, could it be my hormones? And we can take a closer look. Okay. That could range at any age. I mean, if you think about young girls, they get put on birth control packs very early, sometimes 14, 15, 16, to control, symptoms that are and side effects that are coming from their hormones going all over the place. So really, hormone therapy has been a part of people's lives for a very long time.
You said we look at blood work, but what kind of normal everyday symptoms can people be, looking out for?
Yeah. Well, let's take, for instance, a man maybe in his 40s, 50s, 60s. He may be just really fatigued, maybe noticing in the last 5 years of his life that he just wants to come home from work and go to sleep. Doesn't have a lot of vigor. He doesn't want to go to the gym, or if he makes it to the gym, he really doesn't have a great workout. So that's one thing. So we would take a look at their testosterone and see what are their levels. Maybe a woman has just been gaining a lot of weight, just no matter what she does, she just cannot drop the weight. Or maybe she drops 5 pounds and then it just comes right back on. Maybe she's got hair loss, foggy brain. We would look at her thyroid hormones. And not only that, we would take a look at her estrogen and testosterone. So many hormones play a role in our everyday lives and dictate how we feel and how we function.
Okay, perfect. And how do we know, we treat testosterone, estrogen, and thyroid. Is there a specific dose? And if so, how do we know what dose?
Well, I think a good rule of thumb is to always start low, because you can always add more. But the biggest important key is to always listen to the patient, listen to their symptoms. That's key. That's number one. And they're all their symptoms are gonna vary. So we start by really listening to them, because usually, that's why they're here.
Yeah. Their
doctors have not been listening to them. They have said something is wrong, and the doctor just continuously says, well, your labs are normal. Well, typically they're not. And even if your labs are normal, if you are saying to your doctor something is wrong, then likely something is wrong. We're not meant to go home and just fall asleep every day after work. We're meant to be enjoying our lives.
Yeah. Especially
the young ones. I'm in my 40s. I could benefit from hormone therapy. Families, men and husbands and wives in their 50s. That's not the time. You're not supposed to be declining. We're supposed to be living our best lives then.
Yeah. And then what products, whether it be, I've heard, the bioidentical hormone, and then there's pellets and shots and pills and creams, and
there's a
whole bunch of options.
Right. Well, specifically to Recharge Clinic, we do bioidentical pellets. Those are the best. And then we also do offer synthetic, shots. But we are having a talk on January 27th at 6 to 7:30, and we will be answering questions that ladies may have about that kind of stuff. We'll delve into that deeper. and get a little closer look at, bioidentical hormone therapy and synthetic therapy. And again, listening to the patient, because one isn't always right for the other.
Perfect. Well, thank you so much for answering our questions. Like Melissa said, we are having actually 2 seminars coming up. January 27th is going to be specifically for the ladies. Melissa and our other female provider, Avery, will be answering all your lady questions from 6 to 7:30 at our main clinic. And then February the 3rd is with Dr. Tish for our guys. We're going to do a men's health hour from 6 to 7:30 as well at our main location. So everybody can ask all the nitty-gritty questions they want to know about Recharge Clinic. Thank you so much for joining. If you have any questions, feel free to comment down below or give us a call to schedule your free consultation.